Good afternoon. I'm George Latimer, Westchester County Executive. This is our 2 o'clock update, weekday update, daily update on the coronavirus outbreak here in Westchester County. We thank you for watching. We have a number of items that we want to cover with you so you know what the status of these things are in Westchester County. Based on the statistics that we have through Sunday in Westchester County, there have been a total of 23,803 individuals that have tested positive for the coronavirus in Westchester County. And that is out of an overall testing group of over 70,000 tests. That is more tests, absolute number of people tested in Westchester County than in any other jurisdiction outside of New York City. And per capita, it's the largest in New York State. So I have 70,000 people tested, 23,803 have been identified as positives. Those numbers are accurate as of yesterday. We're still waiting for the state tracker today to update and give us Monday numbers. Of that total, we have identified 10,080 cases are active cases. That discounts the 13,000 people who were tested positive as of 2 weeks ago and now have gone through the period of potential incubation in their system, and they've passed through that experience, and now they're not considered an active case because they've gotten through that period of isolation or quarantine. The important thing to note is that the active number of cases of 10,080 is over 1,000 cases down from where we were 10 days ago, and that is good news. We still have a ways to go to show a tremendous decline. The decline is very incremental. It's more like a flattening out of the process over the last few days, but that at least is a positive outlook. We have topped out at one point in time at 11,000 plus active cases, and that number has now been diminishing down to the number where we're just above the 10,000 mark. Hopefully with today's statistics, we'll see a reduction below that number based on the number of people that test positive, and then also on the number of people that were positive previously. As of Sunday, we had 1,089 people hospitalized. That is the lowest number that we have had over the last 11 days, 12 days of tracking. That also is a sign of the flattening out of the curve, that there's a lesser number of people hospitalized. I mention this every time in case someone hasn't seen the explanation before. We have over 3,000 hospital beds in Westchester County. The tragedy often comes in when you have more people that need a hospital bed than they have available beds. We are at a hospitalization of 1,089 people at a 10.8% hospitalization rate, slightly below 11%. That number becomes fearful if it's twice as large, if it breaks the 20 percentile range. Then we start to press up against numbers that make it difficult for us. But right now we seem to have weathered what is, at least for this cycle of it, the largest storm. The tragic news as it is since this number accumulates with each passing day, we have 743 deaths in Westchester County attributed to the COVID virus since the beginning of the contagion, which now dates about 6-7 weeks since the original start. That means 743 people were alive on the first day of March that are not alive today on the 20th day of April. 743 individuals. That represent about a little over 3% fatality rate amongst all those who contract the virus. So if the total number of positives are 23,000, 743 dead represents 3% of that number. Our numbers are below that of Nassau, Suffolk County, and New York City. So we are now the 4th jurisdiction in terms of size and scope of positives and in terms of the size and scope of the death factor. The nature of being in 4th place is proportionate to our population because we are smaller than the other 3 jurisdictions, New York City, Nassau, and Suffolk County. But originally Westchester was the first county, the first jurisdiction to have a high number of positive cases. And so now what that appears to show is that the amount of testing we've done, greater than some of the other competitive areas, now give us a better picture of where we are in the situation. And of course, however many of the people that are currently hospitalized, that 1,089 number, how many of those succumb to the disease versus how many can overcome the disease is really what's in question right now. When we look at the geographical breakdown within the county, operating on numbers, again, that we received yesterday, it is important to know, just as it is on the countywide basis, it is true also on the local basis that it tracks the general population. And what we have, without question, is an increase in the population and the number of infections in our major urban cities. I say that each time just to reinforce it. Yonkers has 3,878 cases, New Rochelle 1,700 cases, Mount Vernon 1,655 cases. We have the city of White Plains at 1,008 cases, and Greenburgh town, including the 6 villages of Greenburgh, over the 1,000 mark as well. So those 5 are the top 5. Our congested villages are also fairly high in numbers. Village of Portchester, 658 cases. Village of Ossining, 633 cases. At the other end of the spectrum, the smaller communities have the smaller number of cases. Pound Ridge has 16. We have 22 in Buchanan. We have a number in some of the smaller villages in the southern part of the county, Bronxville at 44, Larchmont at 47. And those are, by comparison, relatively small numbers of positive cases. We're still looking to track through the state the number of deaths that occur in hospitals and in nursing homes, since those are the concentration of the most vulnerable people. This disease has hit tremendously hard among people of a certain age and older. If you are 60 years of age and older, that is the cohort for which 84% of the people who have died from COVID-19 come from that demographic. 60 years of age and older, and 64% of them come from the age range that begins at age 70 and goes on into the most advanced of ages. And the flip side of that is we have very few deaths that have occurred by people under the age of 50, and then practically none under the age of 40 and 30. So this virus works in concert with age and general health, and then some very specific other factors of poor health that combine together. It does affect people disproportionately who are poor, people who are disproportionately of color, African Americans, Latinos, and so forth. But the most important dynamic, I think, is the age factor. That it's clearly something that's not spread across the age parameter equally, but has hit our seniors extremely hard. As those numbers go along, we'll keep tracking them. The important part of looking at numbers is to understand what's happening out there, to test so that we can find how many positive cases there are, that we prepare ourselves to treat the people that get ill who have a positive number of cases. To that extent, in addition to the sites that we've had for quite a while now, we've had the Glen Island facility for multiple number of weeks as a drive-through facility. Westchester Medical Center was the second one to come online. On Friday and over the weekend, we've had a couple of walk-up sites that have opened up. Mount Vernon's Neighborhood Health Center on East 4th Street, right next to Leviston Towers, public housing project, open for business on Friday. St. John's Riverside has a park clinic facility which opened up over the weekend, and they're being able to test people as well. And then more on the way, we hear stories about a number of other places, sites that may be used for testing. And as those things are known, we'll certainly share that with you, so you have an idea of exactly what the testing modules are. We certainly feel we need more testing in northern Westchester, testing sites in northern Westchester, and we certainly want to double down on what we have in our urban cores. Portchester and Ossining would be 2 more that could use additional testing. And we think that's an important element of all of this. We want to highlight that our emergency services operation is doing yeoman work in trying to take in all the requests for PPEs, personal protective equipment, and then getting the information to Albany, and then getting that material back and redistributing it to the various organizations, the local governments, the various institutions that provide online services. This is a highly contagious disease. If you're going to work with people that have this disease, whether you're working with them as a healthcare professional, if you are responding as an EMS person to some other health issue, if you're a police officer, a firefighter, in each of these cases, having the proper protective equipment on you is essential for you to avoid getting the virus. And that's what we want to do. We want to stop the spread wherever it can be. So the PPE process is critical, along with hand sanitizers, things of that nature. We have an extensive team of people that are doing some work on it. I reported from there just last Friday. You had a chance to see a little bit of the backdrop of what was happening there. We're going to have a couple of interviews this week on our 11 o'clock Facebook Lives that will highlight that effort. And we spend time trying to solve the problems of individual institutions. We had over the weekend a call with one of the rehabilitation facilities here in the county, no need to identify them, to try to work through what their needs were and to try to address them, and also try to understand how the product was being used. the State Department of Health officials on the phone were the ones who were most knowledgeable and could help explain these things and go back and forth with the professionals at the hospital. And those of us in the general government listen and then try to work around whatever the final decisions are made. But the important part of all of this is that we're in constant dialogue with those people for whom the need for the PPEs is important, and we're constantly trying to wheedle as much out of the state system as we can to help us here in the county of Westchester, knowing that there are 56 other counties and the boroughs of New York City that are also competing for these very same products, and we have to be as available and as alert and as energetic as we can be in order to get the material we need, because that material will determine what kind of health care the people who are sick will get. I do want to highlight that our economic development team under Bridget Gibbons had geared up a start for assistance to local small businesses on applying for some of the Small Business Administration loans, the Paycheck Protection Program. The program's acronym is EIDL, Economic Injury Disaster Loan or Grant Program. And some of those efforts came to a pause middle of last week when it was announced that the federal government had run out of money for that particular program. Now there's discussions about them refunding it with some additional money. And so Bridget and her team are back in business trying to help people apply for the money. And that's really what our role is to be a conduit, a helpful partner in helping small businesses be able to apply for money. Not everybody has the comfort level with the different things that go on in an application, which can be complicated. It can make the difference of whether you get the money or not. So we're going to try to be there to be helpful in these different things. I'm very much engaged right now in the discussion about how do we as a county government maintain social distancing? How do we maintain certain services? Which ones do we shut down? Which ones do we start to reopen? Obviously, a lot of debate in the society over the weekend about protests to reopen, this state, reopen that state, and the debate is certainly robust. We have been shut down for about 5 weeks from normal economic activity. For some people, they've been able to hunker down and work through it so far. For some people, they find it unacceptable and so forth. We are going to make decisions on one standard basis. And that standard basis is, does the action we take help spread the virus, or does the action we take help minimize the virus, or can it be at least neutral in that process? And I'm going to talk for a few seconds about some of our policies in terms of recreation, because there is no one standard size that fits all. There are people who say keep the parks open all the way through, and there are people who say shut them all down. And each side takes sort of an absolutist view that don't confuse me with the specifics. I don't want to know. I just know that it should be shut down, or I should know that we have the right to enjoy them. Our taxpayers' monies go into it, and they should be open. Well, we're trying to be balanced in our approach. As you've heard me mention in other reports, we are keeping open all of our hiking trails and our bicycling trailways. That would be the hiking at Saxon Woods and the Harrison entrance. That would be all of our various northern Westchester areas that involve wonderful walks through the woods and climbing rocks and mountainsides and so forth. I personally took a walk through the nature study preserve over the weekend in New Rochelle, and that's a beautiful area, connects into the Twin Lakes walking path. And I saw plenty of people enjoying it, but I saw no problem with the social distancing. And I saw people had masks at the ready so that they were ready to protect themselves from others and protect others from themselves. And so with that thought in mind, we're maintaining the opening of our hiking trails and our bicycle trailways. Bicycle trailways would be the Bronx River Reservation, the North County Trailway, the South County Trailway. We have not yet reached the point at which we would normally open our swimming pools and our beaches, and they are under the protection of the governor's executive order that closes these facilities. But as we sit here now as decision makers on our own assets, we cannot plan to open these things on time. The beaches would be open at the end of May, the swimming pools in June. And unless we see something change dramatically between now and the moment of which we have to launch off, I don't envision a May opening. And if it does open at all in June, we'll know that maybe a month in advance, but even that would be under great stress, because we know as much as the swimming pools and the beaches are important, they're great recreation, people cool off on a hot summer's day, it's almost impossible to envision how we would do social distancing effectively in an environment when a hot day comes and we have literally thousands of people in a very confined area in Playland Beach over on the Hudson River side. We're going to lose Glen Island, I presume, this year because of this presence of the testing center at Glen Island. and it takes up the parking necessary and it changes the traffic flow. So Glen Island's off the table, and that's a great loss in our recreation. And the county center, by the way, is off limits too, as it's been reconfigured into overflow hospital rooms for that eventuality. So right now, I would say our policy: keep hiking trails open, bicycle trails open, not opening the swimming pools or the beaches. Fitting into that category as well would be Playland. We have made the decision not to open it on time in May, and I think it's highly unlikely that we'd open it for Memorial Day weekend. That is a great loss in revenue to the county. It's a great loss in terms of the enthusiastic use of Playland. For those who follow the Playland issue in its other manifestations, I'm identified as a person that believes in Playland. I live near Playland. I think it's a great asset to the county. I don't think it should be devolved out of the county's control. But even with that, prudent people have to make prudent decisions. And it is very difficult to know how we would open Playland and be healthy in a way that would allow people to go and enjoy it. And if we do open it and people aren't confident that they're going to be healthy when they go there, then they won't come in the same proportions. And we might open the doors and have a minimal attendance and lose a fair bit of money in the process. So at this point in time, we haven't made any decision to close it for the rest of the year, rest of the season. But opening on time is not going to happen. And it's quite likely now, if it opens at all, it would be in the month of June to go along with what we're doing to the swimming pools and the beaches. So we're drawing differentiations. We've had a great debate over golf courses. We kept our 6 golf courses open for a number of weeks. We frankly thought that they were operating pretty well. We get anecdotes from individuals saying, I saw a lot of people at this golf course at this time of the day. We've sent out patrols to check, and we found very little of that combination. However, about a week ago Friday, or a week and a half ago Friday, the state issued a statement. ESD, Empire State Development Corporation, issued a statement that de-emphasized golf courses. So we took the New York State policy and we closed our 6 golf courses. We are now prepared to reopen 2 of those golf courses: Mohansick Golf Course in Yorktown and Hudson Hills Golf Course in Ossining. Those 2 courses we expect to reopen by the weekend for public play. We believe those courses are the best control environment of the 6 that we have, where we can make sure that the social distancing programs that we're implementing, over and above the fact that a golf course is naturally socially distanced, will make it a safe place to be. We believe it's been safe all along. We want it to be consistent with the state policy. The state policy does not prohibit us from doing this. And so we are making the decision to open those 2 golf courses. And in opening those 2 golf courses, we're going to monitor how the use of those courses go. And we're going to look for examples of social distancing being properly done, or if not, that will inform our opinion before we deal with the other 4 courses. The other 4 courses that exist, there are 2 in Yonkers and 2 on the Sound Shore. On the Sound Shore is Maple Moor Golf Course in White Plains, just next to the Hutch. Also next to the Hutch, a couple of exits down in Scarsdale, is the Saxon Woods Golf Course. And then over in Yonkers, you have the Dunwoody Golf Course, and you also have the Springbrook Golf Course. Those golf courses will not open this weekend, but we are going to determine whether or not we can open them in the future, depending on circumstances. This is a measured approach. Everything you've heard about on television. Don't snap everything open all at once, but at the same time, don't be rigid in your thinking. Allow for flexibility, observe what you're going to experience out there, and determine if we can go forward and open the rest. We are planning to begin Bicycle Sundays on the Bronx River Parkway as planned in the beginning of May. Now, bicycling, again, is a recreation that can be socially distanced if people understand it, that that's the case. And we intend to make sure that people know that they're not going to be out there unless they have masks on. This is not a mandatory requirement of the society, but we're going to make it mandatory if you're going to be on that bicycle trail, because we want people to make sure that they're not interacting and spreading the disease. If we see that we can't maintain social distancing on the Bronx River Parkway for the Bicycle Sundays, we will then discontinue it. It's not my preference to start it and then stop it, but we're not going to be locked into a policy if it's not working. And that same applies to Kensico and Playland Boardwalk and any other place where people congregate. If too many people congregate in an area, we will use our county police and the Parks Department people to try to, quote unquote, break it up and to do it lightly and nicely. But if ultimately we cannot enforce those laws, if it's unenforceable, then we'll close the specific park facility. We're not going to close all of them, because there's no reason to close a hiking facility, a nature center. They're not getting the concentration of activities. So when I have people say all parks should be closed, they're operating out of a philosophy. They're not operating out of what they've observed. And I must tell you that I spent a lot of time over prior weekends going out to look at conditions myself. I don't want to just take into account what people say. Some folks will say this, some folks will say that. I don't question whether they're telling me the truth. It's the truth as they see it at the moment in time that they were there. But I've heard people go off and say, this is terrible, it's terrible all day long. And I was there, and I know it's not true. Many people look at a parking lot and see the number of cars that are accumulated. And they say, well, that's too many people there. Did you see how the people were interacting with each other? Did you know if they had masks on? Did you know if they were maintaining the 6-foot distance? You could see a lot of cars, but that could be a lot of small combinations of people taking a walk around the perimeter of whatever the facility is. So you can't judge it snap like that. We're responsible for 1 million people, not just the opinions of individuals and not just some combination of what you see at a moment in time. And we're trying to be measured. You've just heard me say what we won't open, and you've just heard me say what we will keep open, and you've just heard me say which things we're going to open, but we're going to monitor it with the potential of closing it if it doesn't work. That is the rational, practical way to govern. You don't take ideology and drive the train. You look at practical realities on the ground, and you make decisions based on the type of usage that it is. Now, so much of what's been shut down has been done by the power of the governor. He's using that power regionally. I support its use regionally. I don't want to do one thing, have New York City do another thing, and Putnam and Rockland and Nassau and Suffolk do a third thing, or Connecticut for that matter, or New Jersey, both of which are close enough to us. So I like the idea that we're going to act in a regional capacity. But what the things that are within our authority, and that includes the specific parts of our system, we're going to make individual decisions based on what we think makes sense and from what we know to be true on the ground. Not my cousin went by there a couple of hours ago and he saw this. That alone is not enough of a reason to draw a final judgment as to what we should be doing. And I certainly don't mean to insult anybody, but I must tell you that this is not a time for us to let our emotion drive the train. It's happening enough already in enough other cases. This is the time for intelligent, reasoned action. We must stop the spread, but at the same time, we must deal with the human element. This is a country of people who pride our freedom, we pride our individual mobility. And so if you constrict that mobility, or you frame it by saying you must have a mask on, you must keep 6 feet difference, we're accepting the fact that you want to go where you want to go, but you have to do it in a way that's considerate of your fellow Westchester resident. And this is no desire for overarching authority. I wish I didn't have to worry about any of this stuff. I don't want to sit around talking about which park am I going to keep open. I want to fix them all. I want to make them all workable, marketable places that we can enjoy. The kind of parks that I remember when I was a kid, and I had a chance to enjoy going to this place or that place without fear of these things. But we are in an exceptional time. This is an exceptional time. Exceptional efforts are needed. And at the end of the day, all of this comes down to one specific factor. 743 people have died that were alive 7 weeks ago today. That's 100 people a week for the extent of this contagion. And what we don't know is how many more we're going to lose, how many people we know, how many people we know that are on the edge of living or dying right now in our hospitals. I know of a few people that I know and respect, and we've lost people that we have great respect for, and people that have made accomplishments in this county. So we're trying to make intelligent decisions based on the individual situations that are presented to us. I share the recreation element as just one of those elements, because there are many, many other elements that we have to deal with as well. How do we handle our homeless populations where they exist, Yonkers and elsewhere? How do we handle the areas where the county doesn't have direct responsibility, but we do have policing responsibility? We have responsibility to police the village town of Mount Kisco. We have the responsibility to monitor other areas of the county and on the parkways of the county, and how we have to handle those situations. All of those things are part of what our duties are. So I've gone through all of those different things. I'm very grateful that the governor has appointed me to serve, along with my other colleagues in public office, on the Reimagine New York Task Force. I'll be serving alongside County Executive Steve Ballone of Suffolk, County Executive Laura Curran of Nassau County, Mayor Bill de Blasio of New York City. And with the other individuals that are on that committee, we will sit and talk about, what type of rational state policies we need to have each of us will bring something to the table that's a little bit different. Not only the 4 members, or other members as well, but each of us will have a different reality, and we'll share those realities. Hopefully we'll be able to make some intelligent suggestions to the governor, and hopefully he'll find that of value. But we're going to go forward. We're going to work as closely as we can with our local elected officials, with the Westchester County Board of Legislators. We will have our moments where we disagree on a policy. We'll have our moments where we forcefully argue for our point of view versus somebody else's point of view. But at the end of the day, we will function state, county, village, town, city, school district, fire district, library board. We will function in as cooperative a way as possible. We do not need an excess of politics in these moments. That we have political affiliations, that we have philosophical ideas, it's perfectly fine. That's what makes us a democracy. But by the same token, to use those affiliations to try to drive a wedge between us, when what we need to do is make apolitical decisions, decisions that make sense and have a pragmatic underpinning to them. Economic decisions, health decisions across the board. That is what our mission is. So with that, I'm going to stop the narrative. I'm going to open it up to whatever questions we have. Catherine Chaffee is off camera. She's accumulated some questions from members of the press who have zoomed in. Were this not a pandemic, we would all be in the same room in our media suite, and I'd be able to take the questions from the reporters personally. But in deference to them and their families, we'd rather do this, keep them safe, and yet at the same time allow them to ask their questions. Catherine.
Okay, first question is about summer camps. Can you let the media know where summer camp stands? Who will make the call about whether or not summer camps open? And is it something that's determined by the village, the county, or the state?
Well, there are a large number of different summer camps. The county directly controls a series of camps, day camps and otherwise, that we are directly responsible for. We have some of those summer camps right now that are based out of the county center. And those camps, if they occur, are going to have to be relocated because we will not have access to the county center during the summer months. And, you know, we're not sure for how long we've given up the county center for. It really will depend on how long this contagion lasts. But we have put everything on hold. We have not officially canceled county-sponsored summer camps yet, but we have certainly held off. And this is the time when people do make decisions about what programs they're going to have kids in. If you're going to have a kid go to an away camp, those decisions are made. But what's happening in the overall society is governed by the governor, and he's making those decisions as to whether or not summer camps can function or not. Obviously, it's very hard to keep young kids from being social. The younger they are, they may understand at some level what we're dealing with as an adult society. But you know, they're kids, and they're going to be with each other in that kind of a fashion. There are villages and town camps that based on certain recreational sites and facilities. If the governor's executive order covers all of those, then they're all shut down. If and when those things are lifted, then individual ones will make decisions, and we'll play it as we go. But at this point, we are not ready to open summer camps in Westchester County for those that are at Westchester County parks.
Next question comes from Martin Wilbur. He wants to know what exactly is the role of the Reimagine New York Council that the governor mentioned today. How will it operate, and how long do you expect before it comes back with recommendations or proposals?
Well, all of those answers, Martin, are going to be better addressed to the governor and his staff because he's the one creating the commission. I got a call. I was invited to join. I was happy to do it, but I did not, get the chance to set out any of those parameters. I listened to the governor's press conferences when he does his versions of some of these things a little earlier in the day. But I think he's outlined sort of broad brush what this task force is going to do, but the specifics I think are yet to be determined. So I'm just going to put a rain check on an answer. When I get a better idea of what it is, I'm more than happy to explain it to my friends in the press and to explain it to the people of Westchester County. As it stands now, I'll be participating in it, and we'll see what the agenda looks like as we go forward.
Okay. Next question comes from Mark Lungariello. Was work completed on the county center as scheduled yesterday? Have you any indication if and when it will be used for patients?
Our understanding is the work was completed. I have not been over there to see the final product. I do know there are no patients in there as of today, and I don't know what the state DOH plan is for when they intend to use it. Knowing that the inventory of hospital beds has not been exhausted, as we all feared, we may find that in the short term, those beds may be reallocated for another purpose. But whatever it is, it'll be done through the State Department of Health. And they're looking at statewide bed occupancy all across the state. And it may be that they'll make some decisions on areas that are outside of Westchester County that maybe don't have the same bed count, and maybe they're at a point of overflow, and there may be a transfer in and out. But my understanding is the work has been done, but I don't know exactly how they would plan to channel which patients into that facility.
Okay. Next question is also from Mark. The BOL tax plan, do you have plans to sign it or take other action?
Well, right now we're looking at the plan. We received it today. They voted on it on Friday. It was delivered to us. We accepted the delivery of it today. I have 10 days by county charter to review it, make a decision if I'm going to sign it, veto it, or permit it to become law without my signature on it. We're investigating a couple of other avenues to resolve the issue. As I've said a couple of times before, we presented a plan that is not the plan that has come back to me for my signature. The plan that we had did something very, very important to me, and that is push out without penalty the satisfaction of the individual's payment of county taxes from April 30th to July 15th. And I think that's a very important factor. Now, I may not be able to accomplish that without the support of other elements of the government. I can't impose that myself. But when I see the state push its deadline for filing taxes to July 15th, and I see the feds push their deadline to July 15th, then I'd like to see the county do the same thing. And the late fees that are collected because you pay in May or June or the first half of July, to me, a very small amount of revenue, but it's a very important principle. And the principle is, do you prioritize first the economic pressure that individuals are feeling? If you put that first, and people understand that you put that first, then all of the other tough decisions that have to be made will be made. But if the town governments, the city governments, the county governments say, well, you're having your problems, but we're going to put our economic interests first, that's a pretty strong statement. And the individuals are going to realize that you're really not on their side. And a lower fee is better than a higher fee. And certainly we understand that was the compromise that the supervisors and the board came to. We think there may be another way to skin the cat that would be beneficial for the towns and acceptable to the individuals if we can use that leverage to forego any late fees. So we're going to pursue that. We've got some time to work with. The law wouldn't go into effect anyway until functionally May 1st, because you're not late until May 1st comes around. And then by May 1st, if you have to pay your taxes, well, that's still another 10 days of work, 11 days work ahead of us. And we're going to try to use those 11 days productively.
That was the last question.
Okay, no other questions. We appreciate you listening. We try to keep it to about a half an hour. We hope that we give you enough substance to make this worth your while. Obviously, I share some of my general thoughts. Those who follow me on my Facebook page, my personal Facebook page, will get a lot more of the personal philosophy and ideology. And you can watch it if you want. You don't have to watch it if you want. These updates, which are a little more standard for everybody, we try to put substance in it, and then we try to let you get on with your day. So that's exactly what we're going to do today. We thank you for your time. We will be here tomorrow at 2 o'clock for another update. Hopefully we'll have additional information statistically, other policy issues. Obviously, if you have any issues, you want to give us a call, 995-2900. We're operating with skeleton crews throughout the government world, but we'll get the message and we'll try to get back to you and be productive. And then tomorrow morning, Deputy County Executive Ken Jenkins will be the host of the 11 o'clock Facebook Live program. His guest, I'm sure, will be very interesting, Michael Volk, and he'll discuss a number of issues relative to the coronavirus outbreak. So George Latimer, County Executive, thanks for watching. Have a good day. Be safe. And if you're going out, wear the mask. It's not part of our cultural experience, but this is a special moment in time. Wear the mask. Have a good day, and we'll see you soon.